This is a patient with semicircular tear troughs. The lack of fat can easily be seen. Additionally, a mild blue discoloration caused by the veins shining through can be seen, which are located very superficially in this case. The physician first identifies the position of the facial bones, of the infraorbital rim, and marks it on both sides with a pen. This is to avoid an injection above the rim. Then the areas intended for filler placement are marked. Here it is crucial not to inject into the bone area. This would be contraindicated. Now we start the tear trough injection. For this purpose, first our anesthetic ointment with 20% lidocaine was applied. Exerting pressure with the finger, the correct position of the auxiliary line is controlled once more. The injection must not go above this line. Now the injection area is anesthetized. Now a hole is prepared using a 20-gauge needle as preparation for the so-called tunneling. Then the injection needle, which is blunt and not sharp, is inserted into the prepared hole and advanced to the starting point of the injection. In this way, damage to the tissue is avoided. It is important to know the position of the cannula tip. You can see that it is positioned neither too deeply nor too superficially. Then the physician starts to inject very slowly, continuously controlling the cannula tip. You can see that no bleeding was produced and that the physician's finger follows the slow motion of the cannula, controlling it all the way. The extremely slow injection is the key to successful filler injection and prevents traumatization of the tissue. The treatment is concluded with gentle massage. It is done at a sufficient distance to the orbital rim. The implant is gently pressed upward while permanently controlling its position with the fingers. In this patient, only 0.25 milliliters were injected, and you can see and feel the very soft implant. Swelling can be reduced through application of a cool pack. The little bulge that can still be seen here is the area of anesthesia. The swelling is going to recede after a short time. Now we turn to the other side and also see the applied anesthetic ointment with 20% lidocaine. The ointment is removed and the area is disinfected with alcohol. Thorough disinfection of this area is crucial since the intervention would be rendered unsterile if the needle were to touch untreated areas of the skin. Again, the physician verifies the correct position of the marked injection site through pressure onto the eye. As on the other side, first anesthesia is performed using a very thin 32-gauge needle. The anesthetic is lidocaine without adrenaline. The effect can be seen immediately. it is important to insert the preparation needle at the angle also intended for the subsequent tunneling. By stretching the skin with 2 fingers, the prepared site is opened and the injection cannula is inserted. Again, the exact position of the cannula's tip is constantly controlled by the physician's finger. In the face, principally cannulas with lateral aperture are used. They also have a blunt tip to prevent injuries of the numerous vessels located in this area of the face. Any injury would create a hematoma that would last long and in this way impair the treatment result. Again, you can still see a little bulge caused by anesthesia. As on the other side of the face, a gentle massage of the treated area follows, including fine adjustment of the implant with the physician's fingers. The patient feels absolutely no pain. Under the cool pack, our anti-aging serum is applied. After the use of alcohol, the treated areas are hydrated in this way. As a result, the patient's skin will be soft and pleasant when she leaves the center. Here you can see a line on the patient's chin that is typical for the aging process. Its depth is reduced through the injection. Also in this case, marking of the wrinkle line is the basis for an exact filling and the corresponding success. First, the 20% lidocaine ointment is removed with alcohol. This is the conclusion of anesthesia. Especially in this kind of wrinkle treatment, it is important to sit the patient upright to make the wrinkles clearly visible. In the beginning of treatment, punctual injection is used. A relatively deep and very slow injection is required. The position of the needle tip is carefully controlled in doing so. Slow injection is extremely important in this sensitive area of the face. The physician follows the wrinkle line, applying punctual injection. Once this first, so to say, deep basic injection has been concluded, the superficial parts of the wrinkle are filled. This is done using both the punctual and the linear injection technique. This technique is also suitable for the treatment of very deep nasolabial folds. Also in this case, it's important not to overdo the massage, but to exert a gentle pressure instead, and to feel the implant to position it correctly. Again, cool packs should be applied at the end of treatment. Fine cheek wrinkles are best visible when the patient smiles. As this is a very superficial injection, the needle is held incline. This makes it easier to realize an optimal injection angle. Marking the beginning and end of the wrinkle makes orientation during the treatment easier. For this very superficial injection, the tissue needs to be stretched tightly. This can be done either from within the mouth or, like here, from outside using 2 fingers to stretch the skin. Here, the needle can be seen very clearly at a superficial level in parallel to the skin surface. In this treatment, a slow injection is crucial to avoid the hazard of bump formation. The exactly positioned implant is clearly visible. There are in fact patients where this indication lasts for 2 years. The leaking droplet indicates that the injection was slightly too superficial. However, this also depends on the individual condition of the skin and on the pore size. By now, a line can be seen. The high hyaluronic acid used by us does not lead to blue lines, as is often the case, for example when conventional high hyaluronic acid fillers are used. Also, the narrowing end of the wrinkle can be safely filled applying this injection technique. Again, the treatment is concluded with a massage. For this purpose, several fingers inside the mouth provide the necessary counterpressure for a soft and gentle massage that is more like exerting some pressure on the implant. The next special treatment begins with removal of the anesthetic ointment. Fine perioral wrinkles are to be removed. They run line-shaped towards the lips and into the red of the lip. The treatment starts with a very fine injection of the vermilion border. The first injection point is in the middle. From this point on, the injections follow the line of the vermilion border towards the corner of the mouth very superficially and in several steps. You can see the lip bulging inward and an optimal contour being formed. As can clearly be seen here, the injection is made evenly and slowly at a very superficial level, and only while the needle is retracted. The chosen needle depth is perfect for this treatment. For the small wrinkles running toward the vermilion border, the cannula is directed longitudinally to the wrinkles, and the injection is performed. Depending on the wrinkle size, the physician uses either the punctual or the linear injection technique. In treatments of the vermilion border, it is beneficial to stretch the skin to be able to prepare the injection tunnel precisely. Also on this side, the fine wrinkles running towards the vermilion border are treated with the punctual or linear technique, depending on their size. In contrast to the lower lip, the fine upper lip wrinkles do not reach into the red of the lip. Obviously, a relatively short time has passed since the last treatment. By squeezing the lip area between the fingers, the physician identifies the wrinkle positions. It is preferable to stand above the patient to be able to perform an optimal visual evaluation of the areas. At the same time, this position is ergonomically favorable for the injection, which can be very easily made along the axis of the injection cannula in this way. We can see that in this area there is actually no visible line. This can be improved with the help of several partial injections. Again, subsequent massage ensures the fine adjustment of the implant. Here you can see how the physician makes the wrinkles clearly visible using 2 fingers. The injection is made longitudinally to the wrinkle, starting at the vermilion border and evenly retracting the needle. The injection volume depends on the wrinkle size. More pronounced wrinkles do not only require more volume, but also an injection in somewhat deeper layers of the skin. Fine wrinkles are treated at a superficial level. Because of the direction of the injection, the physician should always be positioned above the patient, so that the injection needle does not come out at the vermilion border, but a little farther away. In this way, bumps on the lip line can be avoided. Now we see Botox treatment of the so-called glabella or frown line. Muscle activity clearly shows the lines to be treated. Here, dots of lidocaine ointment were applied. The first injection is made near the periosteum. Also in this case, injection is made while retracting the cannula. The second injection is made at the periosteum. For this purpose, a very deep insertion of the needle is required. Pressure with the finger will ensure that the botulinum toxin goes into the orbital area. This procedure is repeated on the other side. Again, pressure exerted with the finger is important. The last injection point is at the end of the muscle, a little more superficially. After the treatment, no pressure should be exerted onto the injection points. The treatment is concluded by application of our serum to hydrate the skin after the use of alcohol. The serum is applied gently, without pressure. The physician now treats another patient and first plans the procedure through marking. The horizontal line starting at the nose and going outward describes the lowest border for the injection of the implant. The other line marks the end of the osseous structure at the zygomaticus. It is important to know where the bone ends. Finally, the injection point is marked, including direction markings for the injection. The marking of the orbital rim forms the upper border for the injection. It is crucial not to go above this border. Here, the physician explains once more that he applied an infraorbital block so that the patient will not feel any pain. Further, it is important to insert the cannula into the injection hole next to the nose, and not coming from the outer cheek area, where the risk of contact with the facial nerve would be given. Also, the cannula should not be inserted at a steep angle, but rather at a flat angle, since many blood vessels are located in this area. Knowledge of the anatomy is crucial. Prior to treatment, thorough disinfection of the whole area is required. Any unwanted contact of the non-sterile skin with the cannula may render the treatment non-sterile. Injection is made using a 22-gauge cannula. Naturally, this is a blunt cannula to avoid damage to the tissue. Care must be taken to avoid contact of the still visible parts of the cannula with the skin surface throughout the treatment to guarantee ongoing sterility. Using the fingers, the position of the cannula is controlled, and the injection is made while retracting the cannula. This is another example showing how the physician prevents the nose from touching the cannula. The movements are very even, slow and gentle. Usually 1 to 1.5 milliliters are injected. Now the cannula is just above the muscle, thus avoiding hemorrhage. In one session, not too much volume should be injected. Where required, 2 treatment sessions are preferable. Now we see the same treatment on the other side. The tip of the cannula is identified through palpation with the finger. A total of 1 milliliter is injected. The injection is made from the insertion hole at the nose outward, not reversely, because contact with the facial nerve must be avoided, even though a blunt needle with lateral aperture is used. A new insertion hole is used for cheek augmentation. Also in this case, the injection is not made too close to the surface. Palpation with the fingers ensures that the physician has permanent control of the position of the cannula tip. Again, the rule not to inject from the outer portion of the face applies in order not to touch the facial nerve. Again, you can see that the physician tries to avoid contact of the still visible part of the cannula with the skin or his hand. This is the only way to ensure absolute sterility. Subsequently, the physician puts his fingers in the patient's mouth to verify the exact position of the implant. Here we see patient number 3 during the preparation for cheek augmentation. The marking of the treatment areas is always followed by meticulous disinfection. By preliminary insertion of a sharp needle, the physician opens up the treatment area. The patient does not feel anything. The control of the cannula tip is again taken over by the physician's fingers. This permits a targeted injection. The patient did not wish to have a very strong correction in order to obtain a very natural result. Nevertheless, it's necessary to inject about 1 milliliter above the muscle, however, not in the periosteum. As usual, the injection is made very slowly. This technique is also suitable for the treatment of nasolabial folds. Also, the zygomaticus can be lifted using this technique. The position of the implant is verified again and again through palpation, and the treatment is adjusted accordingly. After conclusion of the treatment, the position of the implant is controlled. It is important not to press it downward, but slightly upward instead. Also, in placement of the preliminary insertion, a narrow insertion angle should be chosen for the cannula. Again, we see the physician's fingers palpating to place the implant precisely. The marked auxiliary lines help the physician direct the cannula absolutely targeted. Of course, care is taken throughout the procedure to avoid contact of the cannula with the skin to maintain the cannula's sterility. Now we show a lower lid augmentation. Above the orbital rim, the maximal border for placement of the implant relative to the eyelid is marked. Laterally, we can see a bulge that was caused by anesthesia with lidocaine. Preparation of the hole for injection is again made using a short cannula. The use of a blunt cannula for injection prevents penetration of the vessels. This is a good picture of the position of the cannula. Starting at the end point, the injection is made while slowly retracting the cannula. The patient feels no pain at all. Here, the cannula gets slightly out of the way to avoid the tear trough. It's better to begin with 0.2 or 0.25 milliliters than to inject too much volume from the start. The patient is a very good candidate for the subsequent lower eyelid blepharoplastic. As you can see, there is no bleeding except for very little hemorrhage at the injection hole for the treatment. Again, serum is applied to hydrate the skin. Finally, the treatment area is cooled with cool packs for about 10 minutes. On the other side, the orbital rim is marked while exerting gentle pressure onto the upper eyelid with the finger. Again, the upper border for the implant is marked. Here you can clearly see the vessel that was not penetrated by the injection. Analysis of the vessel areas prior to anesthesia is very important. After preparation of the injection hole, the injection is made with a blunt needle. You can see very well that the needle has now reached the starting point for the injection. Now the implant is injected while slowly retracting the needle and under permanent visual control of the injection volume. Now a treatment of oral commissures is performed. The area to be treated is marked, since the insertion point for the needle is at a little distance, and treatment success can only be ensured through precision. The pressure test shows the inadequate elasticity of this treatment site. Now the physician explains the injection strategy. The physician is positioned above the patient and directs the needle from a point of insertion above the corner of the mouth to the treatment site. After the now already familiar preliminary preparation, the injection cannula is inserted and brought to its starting point. The exact position of the needle can be identified very well by palpation from within the oral cavity. If the position of the needle tip is correct, the injection is slowly started. A minor correction with a smaller needle lifts the corner of the mouth and makes the treatment result perfect. The position of the implant is corrected and optimized through gentle massage. This massage should not be too vigorous, not to make it painful. The same treatment is now performed in the other side of the face. The routine includes marking and planning of the injection strategy. After preparation of the injection hole, the injection is performed using a blunt cannula. With the patient's mouth opened, the physician controls the exact position of the needle and then decides on the starting point for the injection. The injection is made while retracting the cannula under continuous palpatory control with the fingers. With a small concluding injection, the corner of the mouth is finally lifted a little. This is the end of our instructional film that showed a selection of special treatments.